Of course. So welcome to the MFCA's second webinar. This is our media roundtable. We certainly encourage both media members to attend as well as just fitness center owners and operators. We'll go around the table real quick and just do some introductions before we get into it. I'll start with myself. My name is Mike Stack. I'm the founder and CEO of Applied Fitness Solutions. I'm also an exercise physiologist by trade and training, and I'll be doing much of the moderating for today's webinar. Brian, why don't you go ahead and introduce yourself?
I'm Brian Reef. I'm the co-founder and CEO of PF Michigan Group. Our company owns and operates 45 Planet Fitness locations throughout the state of Michigan.
Stephen, why don't you go ahead?
Hi, I'm Stephen Todd. I own a couple of powerhouse gyms, president of H&R Wellness, and do some consulting work nationally and internationally.
Ed.
Hi, I'm Ed Icomp, and I'm Executive Vice President of Real Estate for Planet Fitness Michigan Group, working with Brian.
Awesome.
And I'm Alyssa Tushman. I'm co-owner of Burn Fitness. We own 3 locations in Southeast Michigan.
Awesome. And this was our crew that was on here last time, with the exception of we switched out Ed for Matt Grabowski for Ed. So Ed, thank you for joining us for the first time. And yeah, guys, we're here on an interesting day. We're here on a day that's the 1-year anniversary of the World Health Organization declaring this a pandemic. And I think it's very appropriate that we have the discussion that we're going to have today. Just some housekeeping notes before we actually get into the conversation. This will be recorded. We'll be sending out a recording to all the attendees as quickly as we possibly can afterwards. It takes the video a little bit of time to be able to render. We'll push that out as quickly as possible. For those of you that are in the media that are listening, we will also have a fact sheet as well as a short news release that we'll be sending off to you. We're going to push that out as quickly as we possibly can. And then I'll be available for follow-ups myself personally, or to be able to direct those to any of the panelists that you need access to within the next 24 to 48 hours. So please don't worry about taking notes feverishly on everything we say. We're going to try to get you as much support information as we possibly can. Please, if you do have questions, put them in the Q&A feature that you should see on the bottom of your screen. We'll work to answer questions throughout, but we're committing to have a dedicated period of about 20 minutes or so at the end where everyone is free to ask questions. So more than likely, we'll hold most of the answers to the questions to then, unless it's particularly germane to the topic we're talking about at that point. So those are the housekeeping notes. Certainly anything that needs to go in the chat or the Q&A, we'll get to as best as we can. So with that said, we're entering the spring of 2021, and illness and death counts are steadily going down, and vaccines are going up, and that's good. The pandemic is easing right now, mercifully, a year into this. But we're here to say today that no one's talking about the underlying public health crisis that's been created in part because of the pandemic response. We know that national data is emerging on what these lockdowns have done to the physical and mental health of our communities. We know that people are more obese, depressed, addicted, and suicidal, and sadly, just in general poor condition than they were a year ago. And research suggests that step counts have dropped by 20%, and obesity has increased by 20% during this period of time. And this is just emerging data. And this sits atop the notion that we found out in a recent report released in the fall that our obesity rate nationally has climbed to 42%. And these are alarming statistics that existed prior to the pandemic, and they've even been exacerbated more by the pandemic. And part of what we're here to talk about today is that we have been on the front lines of trying to battle this public health crisis of inactivity and obesity and mental health issues for years. And as an organization, the MFCA, we've documented how we've minimized the risk of COVID in our facilities, and we've installed some of the best technologies. I'm sure many of the gym owners and operators that are on here today have many technologies that they've employed, and we're going to talk about some of those. And we figured out a way to run our gyms and fitness centers safe during this time to really serve our communities, to try to keep them as healthy and well as possible. yet we still hear some things out there like the CDC's morbidity and mortality report that came out a couple of weeks ago that talked about the gym outbreaks in in Chicago and in Hawaii. And we're going to touch on those a little bit today. For those of you that dove into that, you probably read that a lot of the basic mitigation protocols weren't followed, but we're going to dissect that a little bit. And most importantly, we're going to talk a little bit about what happened last week with gyms and fitness centers. Even though they are an answer to our public health crisis, despite that, we went up from 25 capacity to 35%. Or 30% capacity, I'm sorry, 30%. That's wishful thinking, Ed. I'm wishing for that extra 5%. We went from 25% capacity to 30% capacity. And there's some confusion around why that's the case based upon the science and the data that we've looked at and we've collected. So we're still fighting a COVID crisis. We're fighting a public health crisis with inactivity, obesity, and mental illness. And there's a business and economic crisis here that's very real. And that's what we're here to talk about today with Brian, Steve, and Ed, and Alyssa. And we're going to get into some questions and then that are just kind of predetermined for the group. And then we're going to open it up. And the place I want to start with this, because I think it's the most important place, is just the human impact of this. The sheer humanity that's happened over the past 12 months is nothing short of astounding. So Alyssa, I'll talk to you first. You cater to non-traditional gym customers at Burn. You've seen these people that are suffering from mental illness, from inactivity, from obesity, and a whole litany of other comorbidities. What are you seeing? What are you hearing, both from the people that are coming through your doors and maybe from some of the people that aren't so sure about coming back through your doors?
Well, the main thing we're seeing is gratitude, merely for being open. I mean, we have sent letter after letter sent to us from grateful members to the administration. One is a vice principal of a local school district. One's from an elderly, he's, in his late 70s, but he's in great shape. An elderly gentleman who's been a member for 10 years. And, these were unsolicited letters. They just happened to come through our email. Just saying how grateful they are that our doors are open, how much better they feel both mentally and physically since coming back to the gym. They feel safe. They feel so much healthier. Their minds are in a better place. And they weren't doing well during the closure. And they're starting to take off those COVID pounds, and they're feeling just so much better that they can come back into the gym. And given that there are numerous testimonials like that, I guess my biggest question is, why aren't we hearing more government officials encouraging people to go to the safe gyms with a 0%, statistically 0% spread? Why isn't the CDC, why isn't Dr. Fauci telling people, go to the gym for your physical and mental health? Given that we know the outcomes and the deaths would be so different. The outcome of this pandemic would have been so different if people's health, underlying health, looked different. We just know. And so again, we're sending these testimonials to the administration. We're doing everything right. And we have it in writing from our members. And we need to do better as a state and as a country with our bodies, because we only get one.
Yeah, I think you bring up a good point there, Alyssa. It's we're fighting a crisis on two fronts from a public health perspective. And sadly, I think public health has been underfunded for several years in our country. And I have a lot of empathy for Anthony Fauci in his struggle just to try to get people to adhere to the basic public health measures, let alone to get them out for a walk. But I think that that's why we're here today, because we're the arm of public health that's not infectious disease. We're the arm of public health that's not epidemiology. We're the arm of public health that is about activity and reducing obesity and all the comorbidities. And I think we all know people who are grateful who are in our gyms. I've seen it. We just had a 94-year-old client come back to our gym last week, 94 years old. And this woman is fiery as all get out. And we actually had a Facebook post with her that probably got more engagement than any Facebook post I've seen for a while from us. And she was just happy to be back in there and excited to be in there. And in all honesty, this woman would be the first person to tell you, like it showed in her physical ability for the fact she was not able to work out during this period of time. And I think that's so important. And Stephen, that's kind of what I want to chat a little bit about with you. You're in your fourth decade in this industry. You've seen many iterations of commercial fitness over time. And what I'd really like you to talk a little bit about is how and why we're well suited to address both the things associated with the COVID-19 pandemic, but also the crisis of inactivity, weight gain, and mental health issues that our society is facing.
Okay. When you put it 4 decades, you make me sound like I put the weight room on the Mayflower on the way over, but it's not that bad.
You didn't? I thought you did.
You know, when I think about, we could talk science, we can talk about technology. What does an exercise facility look like today versus a decade ago, 2 decades ago, 3 decades ago? You know, but I think to Alyssa's point, and kind of at the root of what we're looking at today is, you know, what is our community's expectation of us as a business owner in the area? You know, gyms per capita today is, you know, at its highest if you do pre-pandemic. We take a look at gyms per capita 20, 30, 40 years ago. So we have more exercise or more access to exercise establishments essentially today than we ever have in the history. So when I look at the expectations of our community and our members' expectations, you know, I take a look at what has changed on them over time and are we meeting them? Just a prime example. You know, a little over 10 years ago, I stopped working for all the national big box programs that are out there. And I left, opened up a couple of businesses. And 10 years ago, when people would ask me, what do you do for a living? I would say my wife and I, we opened up a couple of health clubs and we help own and operate a small strand of others. And 10 years ago, people would ask me, what's a health club? And I would really have to walk them through some tiny little differences between a gym and a health club. And I stand here today, and when people ask me, what do I do for a living? I give them the same answer, but I don't have to give some long explanation what a health club is anymore. I think the public at large and the communities we service have seen us go from gyms to fitness centers to health clubs. And I think they understand that there's a progression that's there. So when I take a look at our ability to combat childhood obesity, which is going to be astronomical as we take a look forward, just the obesity that's happening with the pandemic, they already know where we're at. They know that there's an evolution. If you look at the gyms, if you looked at an establishment built in the 70s and 80s, it had gym in its name, Powerhouse Gym, Gold's Gym from the 1970s and 80s. You look at the gyms or the fitness centers that were opened up in the late 90s to early 2000, and they all put fitness in there. Whether it was LA Fitness, 24-Hour Fitness, Valley Total Fitness, they all had fitness in it. And it's because we realized the community needed something more than just an exercise or weight machines. We needed something that was more welcoming for anybody and everybody for the community itself. Well, we get to today and we kind of need something that's more on the health spectrum. You know, we've been pushing for a long time that exercise is medicine, and it's not just physical medicine, it's emotional and mental medicine. We take a look at that. I think that was one of the big changes from a gym to a fitness. You know, gyms were all about making your body look better. Once we got involved in fitness, we said, you know what? It's kind of a little bit more about making me feel better. Whether I look better on the outside or not, I need to feel better on the inside. And then as we take that next step to a health club, I think that we have to realize it's not so much about looking better and feeling better, but about living longer. And we can document that. You know, if anybody goes in for a straight physical, the physician's going to ask you, what are your activity levels? What is your diet like? If you do have something, he's going to write you a prescription. I really wish you would write a prescription. Buy a gym membership, buy a health club, exercise, do these things. Just because he doesn't put it on a pad and send you to a pharmacy doesn't mean it's not part of your healthcare continuum. So that's what we look at. So, you know, when I take a look at the pandemic, I think the biggest thing we need to do is understand that we're in the position to leverage our relationships with the communities. We're there, you know, we're individually owned and operated. We're the gym owners that are there. We've got the highest volume that we can connect with. And the other thing is that we really need to start taking people and going from this concept of survival mode to living mode. You know, there was a period of time where we needed to be in survival. I get that. We're a year down this road at this point in time. It's time to start living at that point in time. You know, whether we want to live longer or live better, but it is time to start living again at that point in time. My biggest concern is anything that sends a message to the public at large, discouraging or restricting exercise or physical activity. I'm just not sure that's the message we want to send to the public at large, especially during this trying time.
Yeah, well said, Steve. And I think it's interesting what you noted, the continuum that we've seen from gyms to fitness to health. And when you talk about a vital sign, for example, University of Michigan Medicine just implemented the physical activity vital sign into their electronic health record system. Meaning when you go to your family practitioner in Michigan Medicine right now, they will ask you, how many minutes per week are you physically active for and what intensity are you active at? And if that doesn't meet the CDC's guidelines of 150 minutes per week, that generates a clinical workflow for the physician. So it is frustrating sometimes that we don't hear the medical community at large moving in that direction. But the good news is there's pockets of it moving in that direction.
I'll just point out, we have a gym that is adjacent to a very large hospital and medical facility. And the second we were allowed to open our doors, it was a sea of scrubs walking through our door. So I couldn't think of a better endorsement that we're a vital position or vital institution that needs to be open, and an endorsement that we're safe and effective than having an entire sea full of scrubs walk through my front door on day one.
Yeah, well said. And I think people are realizing that when you look at it objectively and you look at a lot of the data that's out there, our environments are, statistically speaking, fairly safe. And Brian and Ed, that's where I want to bring you guys in. There has been concern around safety with regard to gyms, particularly early in the pandemic when we really didn't know, and we had really an abundance of caution approach that we took to things. But now we're learning a little bit more. And at Planet Fitness Michigan Group, you guys have put comprehensive safety and cleaning protocols in place, along with some changes to your HVAC system and your air turnover. And you guys even commissioned an independent third party to do an air quality study that laid the foundation for some ongoing tests in other locations, not just within Planet Fitness, but also within some of the other MFCA member gyms. Can you talk about what you've found since December and what you think that points to in terms of just the safety of our environments? Oh, you're muted, Brian.
Sorry. Thank you, Michael. I think like a lot of businesses at the outset, the first priority was to establish guidelines and protocols as it relates to safety and wellness. We have, like a lot of other businesses, a 95-page playbook that we put in place immediately in April that covers everything in and about the gym. We've talked about that on multiple occasions. What we also did along the way was to commission a study at one of our locations in Ohio, an air quality study. So we took the time to work with environmental hygiene labs, mechanical engineers, and to put a comprehensive lab study together. The results of that study that we did, we found no coronavirus in the air samples that we took and on the filters. We have subsequently scaled that study down to a manageable study size. So what we can do is go through and perform air quality studies at all of our locations. And as you said, Michael, the plan is it's a generic program. And we've offered it up to fellow MFCA members who have already, in some cases, completed their air quality studies. So this is on a rolling basis. The idea is pretty straightforward. We have all these protocols in place. We have restrictions in place, executive orders, or most recently, orders coming through the MDHHS. What we're trying to understand is at some point as we progress, we need to, first of all, we want to demonstrate that our gyms are safe. And second of all, we want to work collectively with public health officials and elected officials to move our businesses into the right direction. So since doing that, we have performed over 30 of these air quality studies. And we have yet to find coronavirus either in the air samples or in the surface samples that we are taking. So we're taking the time not only to follow through on these protocols, safety and cleaning and sanitizing measures, but we're actually testing in gyms to confirm that these things are working. In addition to that, we have been focused on the visit to virus ratio, which we've also touched on. And that quite simply is the number of positive COVID cases that are reported in a location versus the number of check-ins that we see in those locations. Since reopening in Michigan in early September across 140 MFCA member clubs, that ratio today is 0.0051%. That's, again, 0.0051%. It is statistically zero. It's the equivalent of one positive case in 19,570 visits to a gym. So I think we can demonstrate statistically that we are not spreading the virus in our gyms.
If I can add some comments to that, Michael.
Absolutely.
Brian pointed out that Planet Fitness has a 90-page, protocol book for our reopening. Many of the MFCA board members participated with the state of Michigan on the work groups that actually formulated the protocols that came through the Michigan Department of Health and Human Services that gyms are supposed to be following. So we participated in helping create that. And then MIOSHA has a program where you can become COVID certified. It's a voluntary program, and Planet Fitness and several of the other brands that MFCA represents have already voluntarily started participating in the program and have all received the MIOSHA certification of being, meeting the CDC and MDHHS guidelines for COVID. So I want to put those 2 points out there. And also one of the things that when we talk about health and we talk about our members, no one's talking really about the health equity portion of healthcare. A lot of people don't have the money or the room to have, a miniature, exercise facility in their homes. And unfortunately, there are neighborhoods where it's not safe to be outside. So to just tell everyone to go outside and go for a walk doesn't necessarily answer the question, either. So I think it's important to remember that there's a health equity issue involved in this conversation. And also to remember that as an organization, we've helped set the standards for what health and fitness facilities in Michigan should be doing. And through the state's own programs, we've proven that we're meeting those requirements in our safe environments. And it's why we are so confused today as to why we were only increased from 25 to 30% capacity last week. We would love for the administration to help us understand why that is. We just don't know.
Yeah, to the health equity point, a lot of people today are saying that they're streaming workouts, and a big piece of that is having high-speed internet, which is extremely costly, and making the assumption that people have high-speed internet at such a high cost is very presumptuous. And just going back to my initial point, I don't see that there is a single more important piece of this argument than taking care of your body. You get one, and taking care of your health should be the single most important thing in a global pandemic. And if there is one silver lining, we need to take that lesson right now. And if you're going to push any narrative, be it the media, be it the CDC, the infectious disease doctors, and the administration, that's what we need to be pushing. And I am just shocked and disheartened that we aren't hearing that.
Yeah, it's interesting. This is clearly a complex issue, like all public health issues are. But I want to make sure I go back to a couple of things Brian and Ed said, because I think they're so important to point out. By my nature, I'm a scientist, and I read a lot of research. And I also work as a practitioner, very similar to how Stephen has at points in his career. And I think all practitioners know that sometimes what's in the science, in the research, doesn't always add up with what's happening in the real world. But we actually have the fortunate situation here to have the scientific data from these air quality studies saying, hey, you know what, there's not COVID really in these HVAC systems. And then we have these visit to virus ratios, to Brian's point, with 1 in every 20,000 check-ins basically having a case of COVID in our facilities. So not only is it statistically significant in the research, but it's practically relevant in terms of what we're seeing in the real world. And I think that's so critical to have both of those pieces. And then lastly, to just reiterate Ed's point on the COVID Worksite Ambassador Program, that was something that my organization, Applied Fitness Solutions, actually was one of the first businesses in the state to get certified through. And I was actually fortunate enough to go to Lansing to speak in the governor's press conference on behalf of MyOSHA and LEO about that program. And I say that a number of MFCA member gyms have hopped right on this voluntary program, which takes the guidelines that basically we instituted and vets them against the CDC and the MIDHHS guidelines and certifies our facilities. So for those of you that are watching this who are business owners, I think that would be a strong step in the right direction to help really show that you are taking that extra step, but realize that as an organization, we wanted to make sure our gyms also took that extra step. So Alyssa, your point on health equity is great. And I think that's something that I want to circle back around to before we end, because I'm sure that a number of people from the media hear that. And that's just such it's a buzzword, but it's also a reality with all the social determinants of public health that exist in our society. So I want to get back to that, but I have to talk about briefly, and Brian, maybe I'll direct this question to you, because if we don't touch it now, it's certainly going to come up in the Q&A. There was the CDC's morbidity and mortality report that came out that stated there were those outbreaks in Hawaii and Chicago, and that really received a decent amount of media attention. Now, I don't think there's a lot to say about this, because when you dig past the first layer of what happened, you start to realize where the issues are really quickly. But do you just want to touch on what is relevant about that both the media and the general public should know about what they found with those outbreaks and, practically speaking, what it means?
Yeah, so I think, like a lot of things, there's an inherent danger in when you report something like that and then it gets blown out of proportion and generalized across an entire industry. We know factually that these were two locations. They were doing group fitness. They were not wearing masks. They were not practicing social distancing. They had members that had symptoms and were ultimately COVID positive that were in those facilities. So it's to make that comparison is about as far a stretch as you can get in terms of the safety and wellness in gyms, especially the gyms that we're talking about here in Michigan, where we have very comprehensive safety and wellness protocols in place. And we've said it before, and I know I sound like a broken record, the safety and well-being of our employees and our members is our number one priority. It always has been, and it will continue to be. So, that when something like that happens, and you just kind of cast these dispersions that, well, those gyms aren't safe, so all gyms must not be safe. It's frustrating.
And Michael, if I may, there was also a news story yesterday on Fox 2 about a martial arts studio in Brighton, Michigan, that had several reported cases of COVID-19. And again, first off, it was labeled as a gym and it's a martial arts studio. And then secondly, when the owner was interviewed, clearly stated that he didn't have high regard for the CDC protocols. So again, it's an example of, it's sensational, to talk about it, but if you get into the details, it's very obvious that this is a one-off person that isn't, in my opinion, really looking out for the best interest of his members. Because we are really the only industry that is membership based, We're doing the contact tracing. When the comments made about, statistically zero, the cases that are reported are people that have visited our facilities or employees who have come to work and later told us that they were exposed to or contracted COVID. And we report that. Doesn't say they got it in the gym. It says that they had COVID. And we responsibly are reporting all of those statistics and still are statistically zero.
Yeah, and I think the thing that comes to my mind is there's no mitigation protocol that will work if people are symptomatic and COVID positive. You can social distance all you want, and you're still going to run that risk. And so part of it is on the personal responsibility of the people at those two gyms to not go to the gym when they are positive. And I think the last thing that struck me with that morbidity and mortality report on those two gyms is that's really the only two gyms that I've heard of in the past 10 months where you've seen a substantive outbreak occur. And I think that in and of itself speaks volumes to what we're seeing in terms of the data from MFCA member gyms is consistent with many other gyms and fitness centers around the country that are also adhering to similar CDC and local and state health department guidance. So we definitely see, I think, by and large, not only do our data clinically suggest with the air quality study that we're not seeing transmission, but also practically speaking from all these different sources, we're seeing a very minimal transmission in our environment.
So all of this is true, but pardon my repetition because I feel like we're sort of getting off topic from the point of our webinar today, which is the pandemic within the pandemic. If you really want to live through a pandemic, be healthy, take care of your body. Our gyms also did the ambassador program and we didn't just pass. We got a 98%. We're practicing all the social distancing, 100% mask wearing. But if you really want to be safe, be in shape. That was our whole MFCA campaign is you're safer in shape. Take care of your body. I'm sorry to smash everybody's head against the wall, but that's what we do for a living. I mean, I go back to this because this is why I came into this industry. I survived a very serious cancer at age 27. And so I'm extremely passionate about taking care of your body. And it's sort of how I pay it forward. And I'm sure in this industry, we've all seen some really wonderful stories about how our businesses have been impactful on people's lives, but it's the truth. I mean, if you change your life through diet and exercise, that's the real story.
Yeah, indeed. And I think it's interesting how that falls into the background because on some level, we think it's so obvious that that's a way to improve your health and your well-being, but evidently based upon at least our ability to serve our communities, given the capacity limitations, that doesn't quite resonate with everyone the way it resonates with us. And that's the last thing that I want to throw out. And I'm going to throw this out to the whole group because I think there's a lot of rich things that we could say about this. And we touched on it earlier. Last week, we found out that the state released new guidelines for capacity restrictions in businesses. And we know restaurants, as example, got to increase their capacity to 50%. They were able to double it. And I'm sure restaurants were very, very excited about that. Certainly, we would have been excited with that kind of an increase. Our advancement was from 25 to 30%. And to some degree, as an industry, we're struggling to get clear answers as to why. Now, good thing is tomorrow we have a meeting with the administration to talk a little bit more about this to try to gain some clarity. But I'm curious to the group, what message do you think this sends when the restaurant community gets to double its capacity and the fitness centers and gyms only go up by 5%? What message is it sending? And then maybe practically speaking, what does 5% increase actually mean? Maybe that's the easier question to answer first. Alyssa, what does 5% increased capacity mean at one of your burn locations? How many more people is that?
Well, about 5 or 6. And to me, it wasn't about the 5%. It was more the narrative that it was the story. It was what the message sent. right? It was the messaging. And what it said is, don't go to the gym. It was very dangerous. And again, you see my passion, and maybe I'm not the right person to answer this question because I tend to get a little passionate. But to me, it sent a message, and I love restaurants. I love small business, but it basically said, go eat and drink, but don't go take care of your body.
Yeah, I would say it sends a very chilling, dangerous message, because it's, as Alyssa said, when you do something like that in tandem with restaurants, retail locations, bars, these are things that people frequent on a regular basis, gyms. You're whether you intended it or not, you're saying that there is something inherently unsafe by not moving it up at the same levels, and then beyond that, really without being able to back that up with any science or data to support that. So it was a very damning message that was sent by the administration when those occupancy restrictions were announced 2 weeks ago.
Yeah, and it's a very subtle, implicit message unless you're listening to it. I think most people at this point, and this is one of the reasons we're having this conversation today, most of us are just like, well, thank God something's opening more. And I think that's a lot of what the general public thinks about. But then when you take a step back and think, as great as restaurants are, and they're a great place for community, and that's so important for our health to be in community with other people, gyms are very much that same community, but also add just such another element. So as soon as you dive into a little bit, I think the word that was used was dangerous and also confusing. And I think, Ed, you used the word confusing earlier, and I think that's such a good word to describe kind of where we're at. It's just this dissonance between everyone talking about the importance of being healthy and public health right now, yet not doing the things that can help contribute to improving the health of our population in the state. So what are we doing about it? Before we open it up to questions, right now I briefly mentioned that we're in communication with the administration. We have a meeting tomorrow. What is the MFCA, to the extent that we can talk about that right now in terms of what our game plan is? What are we advocating for? What are we trying to do? What's our general game plan? And I'll just throw that to the group.
All right, I'll take it. I mean, at this juncture, again, safety first, the health and fitness of our members and our employees, utmost importance. We're going to ask for 50% capacity. That's the sum total of it at this point in time. Masks, are still helping with minimizing, the spread of the risk. And social distancing is still at some level, important as well. So it's the change in capacity that is the ask.
Yeah, I think that it goes hand in hand with, we're now starting to experience some tailwinds. Vaccinations are being rolled out. Case counts are coming down, generally moving 7-day averages. So we want to be mindful with an entire sector of the Michigan economy with, taking the appropriate measures to start to ease the restrictions that have been in place.
Yeah, and it's a conversation, and we definitely want to be very collaborative with the administration and having these discussions, much like we've been with MyOSHA through the COVID Workplace Ambassador Program. I mean, ultimately, we are here to serve people and serve our communities. And as Alyssa said, we just want people to be healthier. And the next step that we are taking as an organization is to have the conversation with the administration to say, this is what we're here for. Here is this crisis we're facing. And we need to work with you to be a part of the solution, because clearly, based on all the data we have, we're not part of the problem. So let's be proactive and figure out a way to get there. And we're grateful at this point that the administration is willing to have that discussion with us. And we hope they see the exact thing that we see, which is the crisis that's occurring within this pandemic, which is the obesity, inactivity, and mental health crisis.
So just one last note, we have a congresswoman who comes in and works out at our gym. And clearly she would not be coming in if it weren't a safe environment. And she shared with us a story that after January 6th, where she was present, very much present, they had a call with all of the individuals present where they said, where they were giving them coping mechanisms to deal with what had happened that day. And one of the things they said to them was, go work out, go to your gym and work out. It'll help you cope. And I thought that was very telling. And so the reason I'm sharing that story, part of it is obvious, but another piece of it is we would like some more support from individuals that we've already mentioned, whether it's CDC or the administration of that same nature for both physical and mental health. People need to know that it's a great mental and physical option for them. People need that. They need to hear it because they're afraid, and they should be afraid to not take care of their bodies.
Yeah, absolutely. And I think you do a great job of advocating for that as such an important piece. And I think we could wax poetic on that for hours with our passion for it. But I want to make sure that we do open it up to questions, and we do have some questions in the chat. Carla asked a great question about marketing. Carla, I'll pin that question and get back to you with people that are actually skilled marketers. With all due respect to the group on the call, I don't know if any of us are on the marketing team at our facilities. I'm certainly not. So open it up to questions. You can throw those in the Q&A and we'll just start knocking them out. We have about 18 minutes. First question we have from Katie is, what do you see happening with masks once more of the population gets vaccinated? And this is a tough one, obviously, because this is reliant on CDC guidance, and that takes a little while to propagate itself. But is anybody willing to take a swing at their best guess on that?
Well, I think all we know is that the governor actually said something the other day. I think she gave a 70% number. And that was the first I'd ever heard, was that they'll do away with masks once 70% of the population is vaccinated. But as we know, things change, right? But that was the first time I'd ever heard a number. But we also have to take into account that people are afraid to get vaccinated, that some people aren't willing to, they're having trouble. So, I mean, it's really hard for this group to give a definitive answer because I feel like we know as much as you do.
But I do think the mask will be kind of the last thing to go, right? That'll be the last thing to go.
Yeah, and to be clear, like for the MFCA, we support all of the public health guidelines that exist right now. As long as the CDC and MIDHS suggest that masks are appropriate in our settings, that's exactly what we're going to do. And I think science moves slow. I'm the science guy, and I inherently know this. That's why you've heard changing recommendations throughout the course of the pandemic, and it just seems to be a little bit of a moving target because we've learned things, and particularly with new variants emerging, it's going to be complicated. But we do know that people could exercise safely and effectively with masks on. Now, I think the biggest thing that we're looking for as an organization is just how to be able to get more people into our facilities, because there is that demand. Stephen, when we hopped in the meeting yesterday, I think you had mentioned briefly that you're actually having to turn some people away now because you don't have enough space for some of your classes.
Yeah. So we if they didn't have a reservation, if they weren't on the app, they weren't signed in. I mean, we get creative in how to solve our problems. I mean, I have 3 clubs that are 24 hours now that were not 24 hours a year ago. So if I need to open earlier or stay later to try and service my customer base to fall within the requirements, I'll do that. If I have to take, instead of running 4 Group X classes, run 8. So my payroll is up, my enrollments are down. So from a business side, that's not necessarily the right decision, dollars and cents, but from a community service, an obesity pandemic and trying to get people service, that's the right decision that I'm going to make as the business owner. So, but yeah, I had to turn people away for certain classes because we were at capacity.
And to Alyssa's point, and I've done the math, I'm sure Brian and Ed have done the math. When we saw that 5% increase, practically speaking, I'm like, okay, that's like 9 people. And like Stephen said, we've bared the brunt of all these additional expenses, opening more hours, greater labor costs. So there's consequences. I think that's the important thing to know about some of these decisions, and they're real economic consequences. Here's another. We're going to get the tough questions. We're going to do our best to answer these questions, but I feel like if we could answer some of these definitively, we probably would be doing more than just a webinar for 30 people. But what is the Whitmer administration told the MFCA about fully reopening? I assume when you say fully reopening, you mean the fitness industry. Ed or Alyssa, I know you guys communicate a lot. Has there been any talk of full reopening at this point, or any hint to that direction?
No, the very limited communication that we've been able to achieve has not given us any indication that that's coming anytime soon.
Which is why we want to have a seat at the table. One of the reasons that the MFCA was formed last spring is that we didn't have an advocacy group in the state, and we wanted to have a seat at the table to be able to have these discussions. And slowly but surely, we're inching that chair up to the table, and we certainly are hopeful that tomorrow is our chance to actually set that chair firmly on the table, or next to the table, not on the table. We don't want to set it on the table. Let's not be crazy here. Next to the table. Alyssa, we can answer this verbally rather than you typing the answer. Just make it easier. Where is the medical community, state, and local health departments? Everyone knows lockdowns were really tough on people's physical and mental health. How are gyms? This is maybe less of a question, more than a statement. How are gyms only at 30% if they can prove they're safe? It makes no sense. So I guess the question is, how do we have all this data that we've just talked about, that Brian and Ed talked about, the visit to virus data, the air quality data? How do we have all this, yet we're only going from 25 to 30%? Like, objectively speaking, how is that happening?
So sort of my answer was going to be, I think what we need right now are more members of this beautiful Michigan Fitness Club Association that we formed, because I think what we need is a more organized, maybe not more organized, because thank God for Ed, he does the best job ever, but we need a louder voice. So that was going to be my answer. We're all, a little pat on the back for all of us. We're all doing this for free, and we're all doing this with a great deal of heart and love and passion. And we don't mind at all. We all have a passion for advocacy, but if we don't have the ability to have a louder voice, how much further can we take this, and at a higher rate of speed? Brian, don't you think? I mean, that's really what
I agree. Michael, the answer, which I always hate when people do this to me, is answering a question with a question. It's a great question. We don't know.
Yeah.
Right. But I think we need a louder voice, and I think we need, like the restaurants, right? I mean, we always talk about that. They do a great job. The salons even, they've been at it longer. And I think that's sort of what we need, is just a louder voice, because we do, right, like Brian just said, it's a great question, and we do have all of the evidence on our side, but we just need a little bit more.
And we're working on it, and it's a paradigm shift, right? We need to help educate the state of Michigan, and hopefully the country, the importance of health and fitness, the importance of having health clubs, and getting that message out there, hopefully through the people who are listening today as members, media, just interested parties. We need your voices to help us get the message out that we are health clubs, we are health and fitness, we are part of the answer to the solution, not only from, if you get COVID-19, having it less severe. Being healthy helps a lot of other illnesses, heart disease, diabetes. I mean, all of those other, illnesses will, be less hurtful to you if you simply are willing to make the life changes. And that's a hard thing to do. Our society does not promote healthiness at this point in time.
Yeah, we often say that people are a product of their environment. And there's a term that's thrown around in research that it's termed an obesogenic environment. And that's what Western society tends to be looked at, high prevalence of high sugar, high fat foods, low opportunities for activity, high opportunities for inactivity and sedentary lifestyle. And part of that environment, part of that ecosystem are gyms and fitness centers. And I want to go back to something Stephen said when he was kind of running through the historical narrative of the evolution of the industry. I think on some level, there is still a view amongst many people that aren't as acquainted with our industry that we're still that 1988 gym where just the big meatheads went to lift heavy weights and get huge. And that was our industry in its infancy, but we've evolved to the point where, as Alyssa said, she's got a 70-year-old guy who's working out in her club. I've got a 94-year-old woman that's working out in my club. I'm sure Stephen and Brian and Ed have all those similar stories. And there has been an evolution here, but to Ed's point, to shift the paradigm, there needs to be a louder voice, and you need to reach a critical mass. So I think that what I would say, just kind of as a summary to that before we get to the next question, is that we need assistance with advocacy, both inside of the MFCA, assisting us and being a part of our organization with member gyms, but also through your local and state representatives. That's how advocacy happens, is that the megaphone just gets louder and louder and louder. And I believe, this is my personal opinion, I think that it's shared by the group though, that if we had the same loud megaphone that restaurants had, that we would be open to a greater capacity just simply because they have that critical mass of people that's able to voice that concern. Karen asked the question, are there other similar fitness organizations in other states that we can connect with for a unified voice? Yeah, maybe we could talk a little bit about what we're doing nationally and what IHRSA's kind of built out. Added to the list, I know you guys are pretty intimately involved with that.
Yeah. The IHRSA has, which is the International Health, Rec, and Sports Club Association, if you're not aware, has started to work with various state alliances across the country. In fact, from 12 to 1 today, while we're doing this webinar, is an IHRSA State Alliance meeting. So we, through IHRSA and through the state alliances, we are sharing information based on what others have done to effectively get reopened in their states. We've shared information on appropriate protocols, for the gyms to follow to be safe environments. We've shared the information regarding our air quality studies to show that, and made that available to others if they want it. So absolutely, we're definitely working with the other states through IHRSA in what are known as the quote unquote state alliances.
And the other great thing that we've all shared, each state alliance with one another, is the success that we've had with each administration in either getting open or staying open. And it's been very helpful.
Yeah, there's this interesting experiment that's happening around the country right now that I think many people are aware of, which is some states are opening up fully, no masks, 100% capacity, and other states are still a little bit more restricted. So I think one of the things that the MFCA looks forward to in collaboration with its national partners is actually seeing how this plays out. Like, are we seeing increased rates of virus transmission as some of these restrictions get lifted? And probably one of the best things that have came out of this really, really terrible period for our industry is the fact that a guy from a small, like mom and pop gym like AFS, same thing with Alyssa, is sitting here with a guy from Powerhouse, a brand that's been around nationally forever, with two guys from Planet Fitness, and we're having a conversation about how to make our industry better. I hadn't seen this in my 22 years in the industry prior to this. And so, Karen, we are working very hard as an industry to unify our voice. And I'd say at the national level, IHRSA is doing a really good job of accelerating what they're doing. But we definitely need more work on the state and the local level, because ultimately, as everyone's well aware from this pandemic, it doesn't really matter what comes down from the federal level. It matters what happens at the state, at the county, and sometimes even the city level. And that's where the more advocates we can have, the more of a difference we can make.
Yeah, one thing, if we have a voice right now, we really need more representation from up north, the Upper Peninsula, the west side of the state, the middle of the state, the thumb. We need that right now.
Shout out
Not
to Jane.
sure.
Shout out to Jane and her 4 Anytime Fitness clubs up north that became MFCA members last month. We appreciate the representation from Jane and Anytime Fitness up north. What about connections with local large hospitals? Can we ask them to be any type of advocacy for us? That's something that I've always been interested in. Have we had any conversations around that anybody wants to touch on?
Hey, Michael, we do 2 rather large medical-based programs. One of them's through Metabolic Syndrome Clinic with one of the large hospitals nearby. Getting any traction on that front right now is hard because they're just now getting back on their feet, to be honest with you. When you take a look at the volume of staffing that they had to rotate through, people that normally worked in outpatient clinics being pulled to inpatient. So to try and be, it's going to be a little bit reactive on that and a little bit of the tail wagging the dog. It isn't that they don't see our value and want to do things, but on that same token, their ability to speak and to beat our drum, they're taking care of their own business and licking their own wounds right now as well.
And I would add to that. I think that is part of our efforts going forward with the MFCA. We talk a lot about the wellness delivery system and the paradigm shift that's been mentioned here, and trying to shift the narrative as it relates to gyms. I completely agree with what Stephen said earlier. The gym industry, fitness centers have gone through a renaissance. We're going through a renaissance. There are more concepts out there, more locations. There is something for everybody out there. There was pre-pandemic, and if there's a silver lining in all of this, I think that has it. What has been highlighted is what we started with, which is we need to really start to shift the conversation over to taking care of yourself and the benefits of exercise and physical activity. So how, engaging the medical profession, hospitals as part of that. Well, I mean, they are the wellness delivery system today. So we are absolutely going forward with the idea that we need participation. We are part of that wellness delivery system, and I do think there is a silver lining in all of this, and again that this pandemic has highlighted the need for that, and for us to start to be more vocal about it, and to really just to start to shout Alyssa's message from the rooftops. I mean, you have one body. You should take care of yourself, and we know all of the physical and mental benefits of exercise and physical activity.
And I think that is probably a really appropriate way to tie this all together. So thank you for that, Brian. We were here today to talk about the health crisis inside of the pandemic, and to shout that from the mountaintops, and also talk about some of the real data and statistics that exist around our industry and how we are truly part of the healthcare continuum. But that message only can get propagated with advocacy from everyone out there who's listening, both media and just the general gym and fitness owner that wants to be a part of this. We really appreciate everyone joining us today. We want to be respectful of everyone's time to get this done before 1 o'clock. We're going to be sending out some resources after the fact. I'll be sending that out from my email directly. If you have any questions that weren't answered today and you want to send them back to me, I'll either personally answer them or kick that off to one of the other panelists. Please be on the lookout for other webinars to come in the future. Our goal is to try to get one of these in every month on various topics. And if you do want to engage with the MFCA at all, MFCA fit.org is our website. You can go there and check it out. And please be on the lookout for my email. And thank you so much for joining us today. Panelists, thank each of you so much.
You're welcome. Thanks, everybody.
Thank you,
Thanks,
Michael. Thank you.
everyone.